Friends, let me remove this mask first because I've been asked to talk on pollution. So, I am Dr. JPS Tulsi, a practicing consultant physician in South Delhi at east of Kailash. So, what is pollution? So, this is, an introduction of contaminants into the natural environment that cause adverse changes in the atmosphere or in the environment. The most harmful pollutant are fine PM2.5 particles that penetrate deep into your lungs, and the width of these PM particles are smaller, so small that it is 1/30th of a normal human hair. So it penetrates deep inside the lungs and causes maximum damage. Now, pollution not only affects young children, it also affects elderly, it also affects people who have comorbidities, but it is also known to affect even normal healthy people like you and me. So pollution affects everybody to some extent. In healthy people, definitely it affects. In elderly and young children, probably maximum effects are seen. Now it's a huge concern, especially in the pandemic of COVID-19. Why? Because we have a double whammy, a COVID-19 and a pollution. So why is it so harmful? Because the COVID-19 virus stays in the atmosphere for a longer time if you have pollution. Now, why does it stay longer? Because the atmosphere is heavy, a lot of pollutants in the air, so that's why, and even the temperature is low. Plus, the winds aren't there, so it remains in the atmosphere for a longer time. So, increased cases, increased mortality, and severity of this virus is seen if there is pollution with a COVID-19 infection. Now, as we know that lungs and blood vessels already have some amount of inflammation in this when you have pollution in the atmosphere. And this COVID-19 virus, as we know, is a virus which affects the blood vessels as well as the lungs. So that's why it's become more severe, more cases seen, and mortality also is high. Now, let's talk a little about what the new research says. New researchers say that air pollution is the leading cause of premature deaths globally. And also, they said the Journal of Cardiovascular Diseases said that increased CV deaths like heart attacks, like strokes, like COPD, acute exacerbation of bronchial asthma, lung cancers, etc., are seen more when you have this pollution. Now, what more? Even in pregnancy, see, you have adverse effects in pregnancy in the sense that there is preterm mortality, preterm premature births are also seen when you have pollution. What else? So, WHO says pollutants that pose the highest risks are one, as I said, the PM, then the others are nitrogen dioxide, sulfur dioxide, and ozone. Now, what is ozone? Ozone is a ground level ozone which is there because of the sunlight reacting with the pollutants. So that forms an ozone layer which is a trigger for bronchial asthma patients. So they develop severity. The symptoms are more if you have more pollution. And now the WHO also said that the data shows that 9 out of 10 people, you know, breathe air which exceeds the WHO's guidelines. So 9 out of 10 people, imagine, breathe air which is so toxic, damages a lot of organs in the body. And now let's talk before I end, because I've been given 5 minutes to talk. Let's talk a little about the AQI. What is an AQI? Is the air quality index. So how do you define that? So if you have between 0 to 50 is good. So between 51 to 100 is satisfactory. Between 101 to 200 is moderate. and 201 to 300 is a poor quality, and then between 301 to 400 is very poor, and 401 to 500 is severe, and above 500 is disastrous. So this is all what I have to talk about pollution. Thank you, friends.